Welcome all. Thanks all for tuning in. Great to see so many of you in attendance. So I'm just going to set the scene today by giving you a very brief overview of some of the reports of localized COVID-19 outbreaks that have affected the food industry in the UK over the past couple of months. And also just give a mention to services that we can offer you via our virology department that you may find of benefit whilst we all continue to keep battling through this pandemic together. And then my colleagues will be covering the main points mentioned there in 2, 3 and 4. So Nigel's going to be discussing air handling systems, staff hygiene, as well as cleaning and disinfection methods. Annette will be showing how you can assess virus control measures safely using surrogates. And last but not least, Andrew will be discussing barrier risk management using bow tie methodology, which is a really interesting way to visualize and manage risks, including those associated with the current COVID pandemic. Right, so just as a brief review of what's been happening locally in the UK these past few months. Really, there's been a steady trickle of outbreak events at food processing facilities, which I'll cover in more depth on my next slide. However, you will have probably noticed a general shift in the reporting and news reports from various outbreaks, which were occurring mainly at food processing facilities. And there were, of course, you will probably have seen quite a few notable ones at sporting venues as well, especially during the last quarter of 2020. And that's really shifted more to reporting the vaccine rollout, which of course is much more positive news and which has really been focused on during December and most likely will be the main topic of conversation going forward. And of course, we all hope that we will start to see a decrease in outbreak reports in general anyway. Then, of course, we heard about the emergence of a new SARS-CoV-2 variant as well as a similar one which reportedly originated in South Africa, which none of us really wanted to hear about really, but that's what's happened. So let's just move on now to the news reports over the last couple of months. So recent news reports that I found, and that's from around about the end of November last year, related to food processing facility outbreaks, and these included the following. So there was one meat processing plant in Bodmin that had an outbreak where an undisclosed number of staff tested positive for COVID-19 infection. The report said that additional preventative testing would take place in a bid to try and contain the virus there. Also in November, this was reported in the Glasgow Times, there was an outbreak at a Tunnix factory in Uddingston, which saw multiple employees sent home to self-isolate. It was said that around about 200 workers were in self-isolation, but those figures were refuted by the company, who stated that a number of positive cases had been identified. But back in March, that particular factory was closed for 5 weeks, during which time a risk assessment was completed and significant measures put in place to establish a safe environment for the employees. Moving into December, at the beginning of December, there was a Greggs factory, a Greggs supplier factory in Penrith that was forced to temporarily close. They had to undergo a deep clean after a number of COVID-19 cases were confirmed at that site. There was a spokesman for Greggs, and they stated that they have robust COVID-secure measures in place. Unfortunately, that was the third time that Greggs had been forced to shut part of its production processes as a result of COVID-19 outbreaks. Another report at the beginning of December was in relation to a factory which makes salads or prepares salads for M&S, where sadly a second employee here died during the latest COVID-19 outbreak at the back of our factory in Tilmanstone near Dover in Kent. And 70 other staff had tested positive at the time, and the company said it had rolled out a programme of heightened safety measures at the site, complying with Public Health England guidelines. And then during the last week in December in Cooper Angus at a Two Sisters meat processing plant, which employs more than 1,000 people, they were hit with a new cluster of cases because back in August there were about 166 confirmed cases of COVID-19 connected to the factory, with around 30 community contacts testing positive back then. So what can we conclude from these reports? Well, you will probably notice a pattern in that these factories employ mainly large numbers of workers. Many will be in temperature-controlled conditions, some with high humidity, and perhaps there may be difficulty in keeping physically distance in these environments. All these workplaces reported that they had already had strict measures in place in line with government guidelines and were likely considered to be, fairly COVID secure. Yet we've seen that still they have had problems with containing the virus and with outbreaks in these areas. Most of the testing of individuals that has been done has been as a reaction to an outbreak rather than as a preventative measure, and some have had to revisit their risk assessments and their cleaning regimes. In most cases, the origin of the outbreak hasn't been identified, so it could have happened. It doesn't necessarily have happened or been originated from inside the factory, but rather it could have happened outside and it's been brought in. So it can be said that even with strict measures in place, there is still no guarantee that the virus will not become established in this type of environment. And my colleagues will demonstrate some extra measures that you can employ to bolster confidence that employers are doing everything that they can to ensure the safety of their employees. So just regarding current advice for food producers and food production sites, the advice hasn't really changed in that the risk from consuming foods potentially contaminated with SARS-CoV-2 and then becoming infected with COVID-19, that's really still considered to be a very low risk indeed. Practices within food production sites remain relatively unchanged, so the guidelines which have been already published by Public Health England and the Food Standards Agency still remain in place and should be strictly adhered to. Even more so if they weren't already doing so now with this increased lockdown. And the relevant links to this information is included here in this slide. And don't worry, you'll all be getting a copy of the slide, so you'll be able to get onto those links later on. The Health and Safety Executive also provide guidance, which can be found if you follow the link provided on this slide. And it's perhaps worthy taking note that they are performing spot checks and inspections in all areas in the UK and in all business types to ensure that they are COVID secure. So it's worth just double checking that everything is in place in your place of work with regards to that, just in case they turn up. I just wanted to briefly mention the new variant, which is currently causing a lot of concern. It's a concern because it is considered to be much more transmissible than the original variants, which have been circulating in the UK since the start of the outbreak. This one was first reported back in September, but wasn't identified as a cause of concern until early December. And the result of that saw the South with a full national, Southeast reporting many cases infected with the new variant, ultimately leading to our current position with the full national lockdown. Many people do worry about the term mutation, but it has to be understood that this is a normal occurrence in viruses. It happens all the time with seasonal flu, and it's happened already several times with this one. Sometimes the mutations make the virus less transmissible. In this case, it has made it more transmissible, but it is understood that it has not made it more dangerous than the original one. It is just more easily to get infected by it. So how can we help you? Well, we already have in place a service for environmental monitoring for SARS-CoV-2 in your workplace. This test is most suited to check if there has been any recent contamination on frequently touched surfaces. And a number of our member companies have already been taking advantage of repeated testing of these areas. And examples of some of these are things like door plates, door handles, clock-in machines, work surfaces, microwave door handles, that kind of thing. Other similar frequently touched surfaces. The benefits of doing this are twofold. One is that you are taking preventative action by monitoring your workspaces for the presence of the virus and then potentially identifying that the virus is within your workforce. And secondly, it can provide assurances to your employees that you are actively monitoring the situation and taking every precaution to ensure contamination is picked up early. We are also currently in the process of extending our scope of accreditation to include clinical nose and throat swab samples. The intention is to offer this as a service to workforces to provide the gold standard test, which is the PCR one, which I'm sure you've all heard about. That can indicate if you have the virus present in your body and are potentially infectious to others. And that means also that if this is done on a regular basis, you can put control measures in place rapidly to prevent further infections and the risk of an outbreak at your premises. And I believe that ends my particular session. So I'll hand over now to Nigel. Thank you very much.
Okay, excellent. Thank you very much, Martin. That was a great overview of everything that's been going on in industry over the last year or so and some of the things that can potentially be done to address those issues. So thank you very much. So at this point then, I'll hand over to Nigel, who should be on a different line. So Nigel, can you hear me?
Yes, thank you, Richard. Can everybody hear me? I hope so.
Excellent. I'll just make you the presenter and then the floor is yours.
Thank you very much. Well, hello everybody. So I'm going to have a brief discussion on production area hygiene. So what do I mean by that? We'll review all aspects of production area hygiene through air handling units, water down the drains, and everything in between. What do I mean by everything in between? People movements, traffic movements, etc., etc. So here we go. Air systems. With SARS-CoV-2 transmission airborne, how do you mitigate against the transmission within your production facility? There's basically, you've got passive airflow systems, you've got managed ambient air, and you've also got chilled managed air. So as I said, it's airborne, so how do you prevent it getting into your factory? Well, or how do you, if it's in your factory, how do you manage it when it's in your factory? So you've got filters, there's HEPA are one option, but airflow rates need to be reduced to prevent blow-through. And there are currently chemical disinfectants available that can be delivered into air handling systems. I know of one company that has a chemical that has been approved for use for such a thing. And then you've got UVC, can be used for treating recirculated air through air handling units. Dr. Danny Bayliss is on a committee that is putting together guidelines for the use of UVC, so he's a better person to talk to. So how can it get in? It could enter from outside, but how do you control it once it's inside? And do you know if it's inside? And if it is, if it's got in, how do you know it's in? As Martin has mentioned, we can do testing of surfaces to find out if it's actually arrived. And in the Tönnies abattoir in Germany, it was closed in mid-June with 1,500 workers tested when they tested positive for COVID-19. This then caused the lockdown of the Gütersloh region, which affected an additional 600,000 people. And on investigation, it was found that they needed to make regime changes to the hygiene protocols and to the plant's ventilation system. One of the findings was an inadequate filtering of the air. So did they have the right sort of filters in, or did they have filters in at all? So once it's in, you can manage it to a degree, but the best option is to keep it out. So then we're looking at how we look at people or people systems. PPE. PPE is designed to protect people, not the product. So things like face masks protect people, safety shoes protect people. And then you're looking at personal hygiene policies. Are the policies you've got in place robust enough? Do they need reviewing? Has the frequency of hand washing changed, and is it being monitored? And do they need to be monitored? There are times when you go into food factories and you see people ignoring hygiene rules even before the outbreak of SARS-CoV-2. So if they're cutting corners before, what are they doing now? And are your hand wash and sanitizers fit for purpose? I was notified by one company on LinkedIn about a hand sanitizer that had been pulled from the market, and I found one on the internet that basically said a Shield hand sanitizer gel was recalled due to an alert posted on the 7th of July by the Chartered Institute of Trading Standards. Said it didn't kill bacteria or viruses which could reach the user, and it contains 3.4% methanol, which is actually toxic. So putting things on the market that aren't fit for purpose is one thing that's caused people problems. You've also got to look at staff separation. Is there enough room for 2-meter social distancing? Abattoirs and food processors, generally, you have people in very compact spaces and very tight spaces. There isn't that degree of separation. And if there is that, if you have to separate them that high, there is generally a loss of productivity, which for businesses doesn't help them very much. You can then look at health questionnaires and sickness notifications. Are they filling them in? Are they following the protocols? These are all things that need to be looked at, and we can help with looking at them. Equipment hygiene. So, are your cleaning frequencies adequate? Do they need to be reviewed in light of SARS-CoV-2? Hopefully they are, but at the beginning of the poll, most people seem to think that their sites are secure. Cleaning methods. Do you know if your methods are robust enough to have, and have they been challenged? And what do you need to do to improve them? Excuse me. Detergents and disinfectants, are they fit for purpose? Two of these topics will be covered by Annette in more detail. The picture on the screen basically says that a company that makes an antivirus cleaning product has been forced to withdraw claims that it provides a quote-unquote 30-day guarantee of protection. It was a bus station in Cambridgeshire that was cleaned using a product called Zuno, which was forced to have the claims it had made removed. This was found on the BBC website. I'll now pass you on to Annette.
Okay, thank you very much, Nigel. So that was a brief overview of the hygiene considerations when it comes to considering your hygiene processes and procedures. So no doubt there's plenty more to talk about that. If you have questions about hygiene, then by all means get in touch with Nigel. Similarly, if you have any questions for Martin on either of the two presentations you've just seen, then send those through to me at any time, and we'll come back to them towards the end of the session. So thank you for that, Nigel. So now I'd like to bring in Annette Sansom to cover her part of the presentation. So Annette's going to talk to us about the assessment of virus control measures. So Annette should be on the line. Can you hear me?
Hello, Richard. Yes, I can hear you.
Okay, excellent. So I'll just hand over control of the presentation to you.
Thank you. So I'm going to talk about how we can assess and validate virus control measures. These might be measures that you're developing, looking to put into place, or already have in place, and you just want to ensure that they are working as they should be. So how do we assess virus control measures? In order to assess the effectiveness of control strategies on viruses, we need to measure how the strategy actually affects the infectivity of the virus. Many viruses that infect humans relevant to the food industry are currently unculturable, or they're very difficult to culture. They may be dangerous to handle, so they might cause danger to the technicians as they're handling them, or they might require specialist laboratory conditions. So you may need safety cabinets or extreme measures of protection in order to actually even handle the viruses. You may not even be able to grow them up to high enough levels to properly assess control measures, and therefore it may not be possible to assess and validate the effectiveness of virus control measures using the actual target viruses themselves. The one reason that this is an issue is because the way that we actually detect viruses is by looking for the genetic material. So with SARS-CoV-2, that's the RNA. And so if we find the RNA in a sample, so say an environmental sample, does it actually mean that that detected, so that positive result is a virus that's going to cause an infection? Or could it be a positive RNA result from a decontamination strategy that's actually destroyed the envelope of the virus, say, but left the RNA behind? Because of this, we have limited information on survival and persistence of infectious viruses. And also it makes it difficult to determine with the target viruses whether if a control strategy is actually effective. So what we can do is use surrogates. So we can use other non-human infectious viruses that are similar in size and structure to the target virus, but safer to use in a range of industrial situations. Such surrogates are less difficult to culture and provide a method to assess virus infectivity after treatment, so after you've actually implemented the control measure. As these surrogates are easier to handle and we can get really good high titers of the virus and use them in a variety of situations, then we can carry out trials that are robust and realistic in nature, so in actual real scenarios. And this is a good way to assess virus control measures. We have actually studied a range of surrogate viruses, and we now have strains that we can use for coronavirus and norovirus. So our coronavirus surrogate is actually a bacteriophage, so that's a virus that attacks bacteria. It actually infects a very specific bacteria, a strain of Pseudomonas syringae, and the bacteriophage is called 5-6. It's an enveloped RNA virus and is of similar size and structure to SARS-CoV-2. So coronaviruses like SARS-CoV-2 and influenza. The significant features are that it offers the ability to analyse what happens to infectious viruses. We're able to use it in all sorts of environments because it's biosafety level 1 organism, and that means that we can actually use it out in the real world as well as within laboratory conditions. And it can be cultured easily and enumerated with results achieved in 2 to 3 days. To give you an idea of how our bacteriophage assay actually works, what we do is we would have our sample with the bacteriophage in it. we would then mix that with some of the host and some soft agar. This gets poured onto a pre-poured plate, a base plate, and then incubated for a set period of time to allow the host organism to grow. And what we end up with is actually a lawn of the bacteria, and if you have a look, you see little holes in that lawn in the picture, and that is where the virus has infected the bacteria. So these little plaques here and here is where the virus has caused the bacteria to die, and this is how we look for the infectious action of the virus itself. So we're seeing it actually, the actual infectious nature of it. So we have developed a range of inoculation and recovery methods for Vi-6, and we're able to contaminate and recover from surfaces including stainless steel, glass, plastic, rubber, and a range of surfaces. We can achieve very high inoculation levels, so log 6 to log 8, plaque forming units per centimetre squared. So that means that we can see how good your reduction capabilities are. So how good your system is at reducing the virus, because we can detect greater than a 4 log reduction, which is what is generally considered to be the required reduction for a system to be considered antiviral. With all of the surfaces that we've tested, we get consistent and reliable recovery with a very low deviation between samples. So that gives us good confidence in the method. So we've assessed a range of virus control strategies already. So some of the work that we've already carried out has included in-solution decontamination, following the principles of ISO 14476. So that's where you'd actually inoculate the virus into solution and see into a disinfectant solution and see how much of a reduction that solution offers you. Now we can do that test with our coronavirus surrogates, and we can now also offer that following the ISO 14476 for envelope viruses using vaccinia virus as well. We have also, with our Vi-6 surrogate, carried out surface decontaminations. So that's either using disinfectant solutions, either by applying directly or a fogging application. We've carried out validations of light, so UVC validations and plasma technologies, assessing those kinds of systems, and also had a look at antimicrobial surfaces, so whether that has an effect on the persistence of the virus itself, and whether these surfaces can actually reduce the levels of coronavirus quicker than they would on an untreated surface. We've also carried out some trials using air decontamination technologies against aerosolized viruses. So we actually aerosolize the virus into our aerobiology lab, and we can recover the virus from that, and also look at technologies. I'll show you an example of that in a minute. So we're able to tailor this service to a range of situations, looking at a range of surfaces, surface types, and a range of cleaning methodologies. With regards to surface types, we can look at all sorts, and we've carried out trials where we've looked at different parts of rooms, including high touch points. So another piece of work that we've carried out has been optimization of a virus control system, whereby we've optimized the technologies by evaluating the inactivation under different conditions. So this graph shows the levels of our bacteriophage 5/6 along the y-axis and time in minutes along the x-axis. And this was an aerosolization trial. So we aerosolized the virus into our aerobiology lab and recovered over time. And as you can see, our time is just over 2 hours. This line here is our control. So that's what happened to the virus just in the air. And then all of these lines here are different versions of a similar system. So we were looking to optimize the system, and these are the reductions that were achieved. And as you can see, we can actually measure the regression of the reduction over time and can calculate the death rate from that. So our coronavirus surrogates and new service available. Our 5/6 test offers a method to analyze virus control methods against infectious envelope viruses relevant to this current pandemic. We can determine whether your current cleaning regime deactivates envelope viruses, and we can assess the effectiveness of disinfectant measures on surfaces and in the air, and the persistence of viruses on surfaces. 5/6 is a biosafety level 1 organism, so it's easy to use in comparison to some other viruses, and we can carry out on-site and tailor-made validations using this organism. Some examples of some on-site validations that we have carried out already include in food production areas, communal areas within a food production facility, hotels. We've carried out some trials in hotel rooms, and we're also looking at transportation, so things like buses, trains, and even yachts. So by using a range of surrogates, I mentioned before that we have a norovirus surrogate as well, we can build up data, and this will provide information on the effect different control strategies can have on viruses. Okay, and that's me. Thank you.
Okay, excellent. Thank you very much, Annette. That was some really great detail on the technical aspects of methodology and assessment methods. So whilst we've talked about everything at a top level so far, this gets into detail on how the work is actually performed. Once again, a brief overview. So if you have questions, then by all means get in touch. So thank you, Annette. Okay, so that just leaves our final presenter. So we should have Andrew Collins on the line, who's going to talk to us about the risk management side of COVID, more specifically bow tie methodology. So Andrew, are you there?
I am indeed. Can you hear me all right, Richard?
Excellent. Thank you very much. So over to you.
Thank you very much indeed, and good afternoon, everybody. So we've heard an awful lot of information about COVID and about the management of it, but what I really want to talk about here is about the management of the risk, and using a number of different tools that are available to us and presenting it in a way that hopefully in a rapidly changing landscape that it helps make the communication of how we're managing and using controls to be able to mitigate the risk. And if we look at any basic risk management approach, then what we need to be able to do is to be able to answer some basic questions about what could go wrong. And that could be from the fact that there would be a number of staff off sick, so we're not able to meet production requirements, or that somebody could be infected with COVID, or they have a family relative or somebody in their bubble that's affected. we need to know, obviously, where and when these failures may occur, and therefore, what systems do we have that will actually be able to mitigate the consequences or potentially reduce the likely occurrence of an infection. And particularly when we see in one of the polls that Richard shared with us at the beginning about how secure people's sites are, but then Martin talked about, well, most of the sites that he listed in his presentation had actually been assessed as being COVID secure. So they already had those systems in place. But we also need to know about, in terms of the vulnerability of these measures, and the fact is that where these measures may actually not be as robust, and also about the information about the effectiveness of those measures. And in terms of looking at bow tie, it's a topic that I have spoken about on a number of occasions. If we think about all of the preventative measures or the barriers that we've got in place to actually reduce the threat of coronavirus or the hazard of coronavirus to actually becoming an event where either a facility is closed down or people get infected, there are a number of factors which potentially could influence that. In other words, put spaces or gaps in our Swiss cheese model that could either be from either an individual's behavior, there could also be some human factors related to the job pressures, or there could be some organizational pressures. And when we actually break these down into sort of human factors, there are a number of things that if we want people to follow the rules, you know, we've actually got to make sure that the communication is clear. Because from an individual's perspective, there may be other issues that could potentially impact on why they don't follow the rules. I mean, we've all seen in the news where, for example, when London went into a tier 4, you know, King's Cross and Euston and Paddington were absolutely swamped with people trying to get out of the capital. And therefore, you know, it's about people's risk perception, that the fact is that they may not feel that they are going to be individually impacted. Or even the fact that the people decide, well, every holiday we've gone up to the Peak District in Derbyshire, irrespective of the weather, we put ourselves at risk, and we also therefore put other people at risk when they have to potentially come and rescue. But also we think about the impact of the job, the conditions of the job. Now that could be in terms of the design, the environmental design, or the fact is that people may get disturbed and interrupted with what they are doing. But we also need to think about, well, there are some jobs which are quite repetitive and don't necessarily engage the brain too much, that people do this. And so if they don't have to engage in terms of with some of the job roles, they are more likely to have a slip or a lapse of concentration, which may actually have a significant consequence. And then when we look at the organizational factor, the fact is that there could be a poor culture. And this is not food safety culture that I'm talking about. This is about the health and safety culture, because people don't get challenged when things may not necessarily be followed correctly, and that there could be deficiencies in or coordination of responsibilities. And this sometimes can be seen in terms of where there's a lot of mixed messaging that's being actually communicated to people. And we've seen evidence sometimes where the government are continually having to change their approach. Because there's a very useful document about how we can consider people's behavior when, and there's a health and safety HSE document which is free to download, and you can see the reference to it at the bottom here. It's about reducing errors and influencing behavior. And particularly when we are thinking about sort of skill-based errors where there's our slips of actions or lapses of memory, the fact is that it's where people are doing quite sort of repeating jobs, or I say repetitive jobs, because they may actually not have to fully concentrate on what they're actually doing. Because there is a way that I've come across that has actually been used in a number of different industries regarding sort of health and safety, pharmaceutical, aeronautical, and also the petrochemical industry. And one of their premises is about sort of psychological safety, and it's where if people feel, particularly in terms of human behavior, that they are invested and they are able to communicate and make comments about how something is carried out in a safe manner, irrespective of their status in terms of a hierarchy. If they feel that they are confident to do that, then they feel much more accepted and respected and are much more likely to follow the rules that we've actually put in place. If it's seen where there's a very autocratic system, then people don't feel as psychologically safe. And there was some work actually done by Google a couple of years ago. They launched a project and they found that those teams that felt a psychological safety were much more effective in completing tasks and much more efficient in following the protocols than those that may have sort of some high flyers. But there is an approach called bow tie, and this is about a barrier risk management, and it visualizes potential risk scenarios, and it helps us to identify and manage the safety barriers. Now, typically, we would look at them as being preventative controls or reactive controls, but they also help us to facilitate risk-based thinking based upon some of their effectiveness. And what I've actually done here is I've actually taken a scenario, for example, to illustrate the point. And in this example, I've taken the operating in an area where COVID is present. Now, Nigel mentioned that it actually could get in, and the fact is that the top event is that an employee could be infected with COVID. So what are the threats and what are the consequences to that taking place? So I'm just going to see if I can expand or zoom in on that because it's not absolutely very clear. So if we look at the consequences to start with, and I'm just going to move this one across here and move that up a little bit. The fact is that an infected employee could infect other people, or the fact is an employee is unable to work due to illness themselves, or that they are self-isolating because of somebody in their bubble. But we've also heard stories about people who have got long COVID, and therefore that's impacting upon their return to work, or that you may be unable to complete any orders. And then when we look at the threat, so these are the consequences of employees being infected. But then when we actually look at the threats or the reasons why people may become infected, again, looking at the presentation that Martin put together, it's about there were incidents that were reported where there were refrigerated environments. There was the close proximity of workers. The work was actually very physical, so people were not necessarily wearing or keeping social distancing. There was also, I think, concerns, and Nigel also mentioned it about in the case in Germany, where there was the cohabiting and socializing of the employees outside of the workplace, and that they were being bussed into the facility from where they lived in shared transport. But there are other things that we need to think about in terms of like the humidity, and in meat processing plants, that was that's purposely there to prevent weight loss of the carcass, or the fact is that we may have aggressive air movement or a noisy environment. And by what I'm talking about noisy environment it means that people will have to shout to communicate, and therefore this is one of the things that the advice says is that we shouldn't necessarily consider as being effective. But if people are having to shout, or even they were talking about no carol singing in churches because of the way that the virus can be spread. And if I take one of those particular lines, so for example, the close proximity of workers, we've got all the measures. Most of you would look at that list and say, yes, we've got social distancing measures. Yes, the message is clear about people should wash their hands frequently. The fact is that they should wear masks either in shared offices, like, for example, in France, where they've been required to do that for a long time, or the fact is in public areas. It's thinking about staggered breaks, that rather than everybody having a tea break or a lunch break at a defined time, we actually put in measures where we're going to stagger the breaks for people. Or we're actually going to put in a physical barrier, such as screens. So, Perspex, I mean, in the first lockdown, it was very difficult to get hold of Perspex because everybody was buying it. And you see that in the supermarkets where they're actually protecting the till operators by putting a physical screen. But as I said at the very beginning, it was very much about, yes, we've got these measures, but which one of them are going to follow? So using this bow tie methodology, and this is some software that I use that is part of an organization called CG Risk, which we have a partnership agreement with them. So we can actually plot these sort of bow tie models in your area. I can actually see how effective those are. So, for example, social distancing. Well, the environment is not suitable. So it's quite often noted that people may not, and this is just hypothetical, may not keep to those social distancing rules. And also that could be because of the noise of the environment. So the fact is, when you've got machinery operating, people tend to shout, or, they may be hard of hearing. So the fact is that they potentially will compromise that barrier, so it will not be as effective as it should be. Frequent hand washing, well, that's something that we typically do quite habitually. So it's not a huge quantum leap that people will consider about washing their hands effectively. Face masks. Oh, okay. We get people to wear face masks, or as Nigel mentioned about beard snoods, the number of times I've been around and carried out audits where one of my observations or my non-conformances has been that people who are supposed to be wearing beard snoods have not done so correctly, because whilst they have been looped over their ears, they're tucked nicely under their chin. So you could turn around and say, well, how effective are those face masks? The other issue about face masks particularly is that obviously it muffles sound, and also that they can get very sort of uncomfortable to wear when you've got to wear them for a considerable period of time. Staggered breaks, very good. So we actually, using this bow tie methodology and this the software, you can actually very simply and very clearly have a very good idea about how effective the barriers that you have in place. Because if any of those fail, then hopefully, would they directly lead to that event where an employee could be infected? Yes, it could happen. So the fact is that we've got to make sure that all of these are in place all the time. And I think in terms of when we talk about this risk communication, it's got to be very clear and it's got to be very consistent. And if I come out again of this particular slide where you can actually see it, I would have barriers on all of those lines. So in terms of the physicality, and hopefully when we actually when I do this sort of modeling, you actually find that there are reactive barriers. So what do you have to do in terms of sending people home because they've got to isolate, so that you actually, much more testing. Martin said that you have an awful lot more reactive testing of employees when you've got an employee that has been identified. So, we've seen this in the UK in some of the professional sports teams, where they've actually had to cancel matches because of, they've got all these protocols in place, but somehow they're not always followed all the time. And it's important to try and make sure that the message is consistent. The fact is that it's clear, and something like I find something like the bow tie approach, with this very visualized approach about the barriers that we've got in place and the effectiveness of them, gives us a very clear message to everybody that needs to be, all the stakeholders concerned. And obviously, thank you very much indeed for listening. So I think I ran over my 10 minutes a bit, but thank you very much indeed. So over to you, Richard.
Okay, thank you very much, Andrew. It was a great overview of the control process aspects of this sort of pandemic, and it goes to show that it's not just about the microbiology. There's consideration for the way we do things that's equally important in controlling in controlling the virus. So thanks very much for that description. If you have any questions for any of our speakers, now's the time to start sending them through. We'll come back to some of those at the end. We have a whole range of information available on our website. I'm not going to go into a huge amount of detail about it now, but I will point you in the direction of certain sources of information. Most of you have signed up to our newsfeed emails. That's how you found out about the webinar, but there'll be several of you that haven't. Perhaps you were told about it by a colleague. If you go to the page shown, then you can opt into our email news service by your area of interest, and food safety assurance is one key area. Microbiology will be another one for this group. Some upcoming events. There have been some changes to our training courses recently because of sort of developments in the outside world, but we do still have some online courses which are due to go ahead. So there are some relevant ones listed here. If you want detail about everything that's on offer, then again, visit the website. Some of you may be familiar with our member interest groups, which were previously face-to-face events like the one you've seen here, but these days they are held online. They're essentially networking events where we talk about the work that we're doing, research work, we get external speakers and allow you to network with one another on a regular basis. So if you're interested in knowing more about that and signing up to the member interest groups, again, by area of interest, then there's a web page for it. If you use social media, then we're on all of the major platforms, so Facebook, LinkedIn, Twitter, Instagram and YouTube. You can follow us that way if that's your preferred channel. So that brings us to the end of the presentation. We'll now start to look at some of your questions. I'm conscious of the time. Some of you may need to leave, but if you are happy to stick around and hear the answers to the questions, then feel free to do that. So at this point, I'll open the lines for all of our speakers so that we can treat this as an open discussion. So we've had some questions come in while the presentations have been going on, and I see we've been able to answer some of them on an individual basis. But for the benefit of the group, we had a question about the price of environmental testing and when the tests are likely to be available. Martin, you were able to answer that at the time, but I think that we're essentially saying contact us at a later date for more information. Is that right?
Yeah, that's right. I mean, obviously the environmental testing is available now, but we are currently, as I said, we're just awaiting the UCAS assessment of the clinical swab testing. That's out of our hands with regards to how long that's going to take, but hopefully that's going to be available as soon as possible. And if you want pricing, please just email me on martindagostino@campdenbri.co.uk. I can't give a price because it depends on how many swabs that you will want testing.
Okay, excellent. And on a similar theme, we were asked about the percentage of swabs that typically test positive. I don't think we have exact data, do we? No. But it suggests that there are some good controls out there. Is that right?
Yeah, absolutely. Yes. And like I say, it would be really interesting because obviously we're not the only provider of these tests, but it would be interesting to see what if we could have some kind of data from all the labs that provide this kind of testing to get an idea of the prevalence within food premises and food factories. But I don't know how achievable that is.
Okay, brilliant. We've got a question that's probably best answered by Annette here. It's about the 5-6 method and whether or not it can be used to validate hand washing. Are we able to say anything about that?
This isn't something that we've actually done yet, but we absolutely could use it to validate hand washing. I can't see any reason why we wouldn't. We have methods that we use for bacterial validations, and we could adapt those for the 5-6.
Okay, brilliant. So it's something we could potentially explore in more detail to figure out whether or not that's an effective method. So thank you for that. Next one would be one for Nigel, I think. It's about guidance on airflow patterns. Is there anything out there to provide guidance, considering things like dilution versus distance travelled and risks versus benefits, that kind of thing?
Generally, it's basically number of air exchanges based on size of the room and a number of people in there and the temperature that you need to maintain it at.
Okay, and are there any industry guidelines available that can go into detail on that?
There are. I can send information on. There are some in the e-hedge guidelines as well regarding air handling units. So that's a good one to start with.
Okay, brilliant. So if you want to find out more information about that, then get in touch with Nigel. He can point you in the right direction. So we've had another question about the new variant of COVID and its infectivity rate, and whether or not any changes have been made to control measures to try and sort of reduce things like exposure time and potentially reduce the rate of spread. Would anybody like to comment on that? It seems like quite a general question.
It's Martin here. I've just said I really don't know the answer to that at the moment. I guess it's too soon to tell, but I'm guessing that the government risk assessors are looking at all these measures that are currently in place and whether they're still going to be effective at reducing the transmission of this virus as well. I don't know what else they can do really with regards to what they're already doing. It might be even too restrictive to be practical, but that's, as I say, I don't know for sure, but I'm guessing that is being considered as we speak.
Okay, we've had a question about face masks and face coverings as well, and effectiveness of those compared to, for example, visors. So I think that might have been something that you answered as well, Martin. Would you be able to elaborate for the rest of the group?
I've seen this as well, and it's been something that I've been queried on right at the beginning of the outbreak when people were wondering what control measures to put in place. Some people were considering putting visors in, which is, fine as a control measure, but I think in terms of practically, when you're thinking about contamination, or if you're coughing or sneezing, and you're perhaps asymptomatic, they won't do a whole lot in stopping the spread of aerosols into the environment. So it might be better to use them as an additional protection over the top of a face mask, I would say. But yeah, I mean, I see lots of people using them in restaurants areas and other areas, and so it's better than nothing, but not much if the person's infectious and they're coughing and spotting all over the place.
Okay, yeah, thank you for answering that one. So there's a question about bow tie risk assessment and where you can go to find more information. That'd be one for Andrew, I think. So where's the best place to start?
Well, there is some stuff on YouTube, but it's not necessarily food specific. But I'm working with CGE Risk about with bow ties, and I've done some presentations that are on our own, through the MIG presentations. Or if you just want to drop me an email, I'm more than happy to pick up the phone and have a discussion and see what sort of the needs are there.
Okay, excellent. So there's a question about ATP swabbing, which I think might be one for Annette. Is that something you're able to comment on? Have we got any experience with that?
I have some experience with ATP swabbing. With regards to viruses, it's really not very relevant because it's looking for cellular activity.
Okay, the comment in the question was with regard to verifying cleaning. So looking more broadly, could it be used for that instead of viruses?
Yes, it is routinely, generally within the food industry. It's an indicator of how clean or how efficient the cleaning has been, but each system is different. So.
Okay, so I'm conscious of time pressing on, so we'll make this the final question. It may be one that several of you could potentially answer, but it's about the impact on certifications of the UK leaving the EU, and whether or not anything has changed, or is it just business as usual there? Can we say anything about that? Or would that be one for our regulatory colleagues?
Possibly pass.
Yeah, I think it might be.
Okay, might have to pass on this one and direct it to some of our colleagues that know more about that particular particular area. Okay, so I think we'll draw the session to a close there. So I'd like to say thank you very much to our 4 speakers today for providing a fantastic overview of the areas they've been working on as part of the COVID-19 pandemic. And also thank you to all of you for joining us today and devoting your time to hear about the work we're doing. So thank you very much. So we will circulate the slides. Some of you have asked about recordings as well. We will produce one in due course, so you'll be able to catch up with anything you might have missed if you joined us late. So keep an eye out for those. So all that remains to be said is thank you very much for joining us. Enjoy the rest of your day and all the best. Thank you very much.